Good morning and welcome to the second part of therapeutic massage. My name is Monique Keller and enjoy this session. In this, you have to know the following: the uses and effects of therapeutic massage. Then we're going to look at use of massage in physiotherapy. We're going to work through palpation, how you actually have to hold your hands and your own body position, thereafter assessment and treatment planning. And we're going to look at other uses. Where can massage be useful? Like for instance, neuromusculoskeletal disorders, edema management, massage therapy for the sport population and populations, the sedative effect and the relaxing nature of having a massage, and the various different client groups. Now moving to effects and uses. The following are uses of therapeutic massage. It can facilitate healing of ulcers, relieves certain kinds of edema, improves circulation. It's also very helpful to maintain the mobility of soft tissue, for instance, muscle, connective tissue, even scar tissue that has formed after an injury or a surgical procedure. It's useful to increase range of movement in joints. So when you relieve the muscle spasm, for instance, in the elbow, in the front, in the bicep, then your elbow will straighten out more. It will improve the elbow extension range of movement. It also influences muscle tone. So you can have a massage technique that facilitates muscle tone so that the muscle is ready to work harder, or relieving muscle tone where you remove stiffness and relax the muscle. It's also very useful to relieve pain arising from soft tissue and joints. So if the pain is caused by something happening in, let's say for instance, the muscle or a joint, then massage can be useful. It also facilitates tissue repair. That's where we looked at the scar mobilization that I mentioned previously. So what are the therapeutic effects of massage? Let's work through it slowly. Fat content of tissue cannot be reduced by massage. Important to note. But appropriate touching with the use of your hands can provoke various responses. It can influence fluid exchange in tissues. That means you can increase the blood flow, or in instances where there's a build-up of protein-rich fluid, for instance in lymphatic edema, massage can influence the fluid exchange by slowly taking out that protein-rich fluid out of that area, so that blood can come in and a healthy environment can be restored. Massage can reduce swelling, and this effect is considerably enhanced by the use of continuous pressure in your various strokes of massage and in your sessions. It often takes more than once, and for a very edematous limb, You will need a number of sessions. Also useful to flush out the tissues, clearing the area of toxins and chemical irritants. Massage causes vasodilation. Have you seen that if you have massaged, let's say for instance, your mom, and she wanted you to just rub her shoulder, how red the area becomes. So there you can see the effect of vasodilation, where there's an increase in blood flowing to that area caused by your massage. Massage has also been found useful in reducing the discomfort of conditions such as fibromyalgia. But here also you need a number of treatments for this. One alone won't work, and a number 7 has been given as an optimum number. Massage, as said previously, can reduce muscle spasm in the muscle fascicles. So it works on the sensitivity of the muscle spindles deep in the muscle itself. And here also, massage reduces the muscle tone, increases range of motion, and reducing the associated pain. What's further stimulated by massage is the autonomic reflexes, your autonomic nervous system, which can give you that sedation effect. Massage also useful to increase general flexibility. Also depends on what massage technique you use. If you do a superficial effleurage, that's not necessarily going to increase flexibility. But if you do your kneading, for instance, that will definitely affect the flexibility of the muscle. Massage can help with sensory recovery if you then help the patient by doing a massage. Very useful in remodeling of connective tissue during the healing process and phase. This is where we talk about scar massage, aligning the fibers of the healing scar so that it remains close and intact, but that it's pliable. You can actually move it, and there's no adherence of the scar to the underlying tissues of the body. Massage can help reduce pain as it stimulates the mechanoreceptors and works on the pain gate. Massage can have a counter-irritant effect. So let's move on to the complications of healing that can be helped by massage. So this means, let's say for instance, you have a patient that went for a surgical intervention. And because of the surgery, there's some complications of healing. Let's say for instance, contractures form, adherence of the tissue to the underlying structures, or an increase in neural tension, meaning the nerves that move through your various limbs, your arms, your legs, there's an increase in neural tension leading to pain. And massage can help all three of these if it is picked up relatively early. Let's say for instance contractures. If your patient only comes to you, referred to you after a year, then the contracture is fairly fixed in the joint, and then massage won't help at all. Then often joint surgery is indicated. But the sooner you can help your patient. And of course, taking into consideration the contraindications of what you can do after the surgery, you can help for these 3 complications of healing. So what are the dangers? Are there dangers in massage? What do you think? Well, yes, if there's a thrombosis, say for instance in the calf region, and you massage over that, then that thrombus can become loose and can move to a different area and be very dangerous for their heart or lungs or brain. It is possible to spread a fungal or bacterial skin infection. So that's why it's important to assess the patient before you start your massage and not just jump in straight away. Tissue damage when massaging over a foreign body or a sharp bony fragment should be avoided. Bleeding can be caused if there's any underlying condition where the person is prone to bleeding and you work too vigorously, it is possible that you will see bleeding under the skin. So be very careful. Here I think about our older population as well with their fragile skin. So be careful there. If you massage in acute conditions, the inflammation can persist for longer than the normal 3 to 4 days. If you massage over open wounds, that can be very dangerous as you will cause further tissue damage. If your patient has skin allergies, massaging over that skin allergies can cause a skin irritation, and that is dangerous. High increased metabolism over tissues with malignant growths and calcifications. So here it is very important that for a patient that has carcinoma, has a cancer, that you communicate to her referring doctor and that you establish, is it fine for you to do massage? So for instance, she just wants a massage to help her relax a bit more, get the tight knots out of her shoulders, and just a general back massage. And the cancer is in her a bone in her knee, that may be fine, but you have to definitely first consult with her doctor. So you have to pick up any cancer in that she may have by asking her in your assessment, and if not, if he or she does not have cancer, that you also then question and find out what's the family history. So a thorough, in-depth subjective interview is vital before you start. What are absolute contraindications? So let's first see what is a contraindication. A contraindication is where you should not do therapeutic massage when they present with the following. So then you will say, I'm unable to do massage over this area, or it's not safe, but go and see your medical practitioner, your doctor, and when you are ready, let him refer you back to me again. So absolute meaning, you will definitely not do massage over an open wound or a burn area. So if there's burns on their back, you will not do massage there. If there's inadequate circulation, where you know there's the limb is not getting enough arterial blood. Then, whenever you do your effleurage strokes or your massage techniques over that area, the body is going to want to send more blood there. But there's not viable blood vessels to accommodate the increase of blood, meaning it is dangerous. Hemorrhagic tissues, bleeding tissues, that's a no-no. Acute inflammation stages. Okay, so that's now where there's clearly a swollen, red, warm, unhappy area. You're not going to massage over that. When there's acute fungal or bacterial infections present, you don't want to work with your hands by spreading that. So a no-no. Febrile conditions where the heart is unstable, then always, if there's a heart condition, let them consult with their doctor and refer when they see that they can have their massage. An area of active bone growth. So that's now where there's been a fracture. Let's say, for instance, a fracture of the tibia, the shin bone in the leg at the bottom. Now that bone is healing. It's early stages, 2 weeks since the fracture happened, and now they want a massage in that area. Not a good idea. You can exercise, you can give them advice to get the swelling down by elevating the leg higher than the heart, but not a good idea to go and massage over that area. So, looking at potential contraindications. This is when caution must be applied. Here, malignant disease like a cancer, like I explained to you the previous slide. Fragile skin. Okay, if you're old lady or gentleman, where you just need to take caution to not hurt their skin or cause bleeding under the skin. Where the collagen is weakened, there are certain conditions where throughout the patient's body there's a weakening of the collagen. Take care when during your subjective assessment you pick up on this very rare condition. Patient with heart problems, take care. Dermatomyositis, this is an inflammatory skin and muscle condition. If they present with that, then also remember that it's a potential contraindication, and you have to use your clinical reasoning if you should go ahead with your massage, or maybe use another modality like exercises, breathing for them. So when caution should be applied. This is where with using stationary pressure techniques. Okay, take care when you keep your pressure on one area. So you'll, in your future training, learn more about trigger point massage. And that is fine to keep pressure on a trigger point when it gives you that familiar referral pattern. But you may not be on a trigger point. You may actually be on a nerve or an artery, and your patient gives you feedback that that's a very sharp, burning, shooting sensation, and it's very sensitive, causes pain. Then you should take caution and move your hand away from that area. Be cautious around endocrine glands or lymphatic glands as well, and in cancerous. patients who present with cancer. So now we move on to assessment and treatment planning. So let's look at your planning. The essential intellectual skills are knowledge, understanding, synthesis, analysis and evaluation, and then reflection. So these are important skills for you that you will start developing, but that you should be cognizant of. That you are now acquiring knowledge as you are working through your material. You want to deepen your understanding of the body's physiology and anatomy, and how the body works, and how the knowledge that you learn can be applied. Then you also have to analyze and evaluate. So now you have your patient, or you have a case scenario. You now have to use your knowledge, your understanding, how you synthesize the information, and you now have to, through analysis and evaluation, make the decisions. Is this a contraindication, or can I proceed? And with what technique should I, massage techniques, should I use for this patient? Thereafter, after doing that, reflect on what you've done. So ask yourself, is that the best technique I could have used? What was the results that I found? Feedback from the patient. What does literature say? Is there something that I might have missed? So use this in your planning for future treatments. Do a thorough subjective and objective assessment with your patient. Clues are found when you do this. You generate hypotheses. You interpret cues from your patient. And this will all stimulate a cycle of clinical reasoning, which will make you a wonderful physiotherapist. Clinical reasoning is important. This is a process through which clinical decisions are made. There's also a problem-based approach, which is useful in clinical practice, and your treatment goals should be set and outcomes evaluated. So what this means is that before you start your treatment or your massage, you should have goals. And the goals should align with why the patient is there on that day. Let's say, for instance, relaxation. Then you are going to, after your subjective and objective examination, choose the correct massage techniques for relaxation. You're going to apply it, and afterwards you're going to evaluate your outcomes. So does the patient feel more relaxed? They mentioned that they almost fell asleep, and that's your outcomes. And also pain, if there was pain in the area on a numeric pain scale, you can then ask them, so what's the pain now compared to what it was before? So if it was a 9 out of 10 shoulder pain, and after your treatment you ask them, so how much is the pain now? And they say, I barely feel it. I would say about a 1 or a 2. That means that's a favorable outcome. Here is an assessment chart where you will see at the top personal details. And remember to work systematically through the assessment chart. The assessment chart may differ from area to area as you go on in your physiotherapy treatment, but always work systematically through it. And before you see your first patient, make sure that you know what is coming next, that you are not surprised by, oh, I see it's behavior of symptoms, 24-hour pattern, and then you don't actually remember, but what should you ask? Right, so the personal details very clear, and that you will definitely get from a patient that can answer in the language that you are asking them. If not, you get an interpreter. So behavior of symptoms in a 24-hour pattern. There you ask. Here you also, what is your knee pain like when you get up in the morning? And then you ask them in that 24-hour pattern, how does that area and the symptoms in that area differ for each area? Say for instance it's a lower back pain and a knee pain. Then you first ask them, what bothers you the most? The lower back. So then you highlight it on the body chart in the right. Then you work with that A1, area 1, lower back pain. When you wake up, how does it feel? And what's the intensity of the pain? So then, when does it get better? Let's say, for instance, at 10 o'clock, when they sit down and have their tea break at work. Then when they stand up, it's painful again. And then at night, they struggle to get their pain from 9 out of 10 down, and they have to go and lie down. So have that pattern of symptom behavior. Under that, what makes it worse for each area, aggravate, what makes it better for each area. Do they take medication for their symptoms? Other treatments? Have a good past medical history? Determine any contraindications. Then look at their posture. Gait, how do they walk? Is there any guarding? So I'm just working through the chart. You will learn all of this in next year. Muscle power, muscle length test, range of joint movement. Following that is your problem list. Right, so a very good and handy assessment chart for you to use. Looking at palpation. Palpation is how your hands touch the area that you massage. And it should be done with using the pads, not the tips of your fingers. So the soft where your fingerprint is on, and not the very tips close to the nails, because it is definitely more comfortable when you use the pads of your fingers. Practice palpation, and this will help you develop the sensitivity of your fingers to what is going on underneath your fingers and in your patient. Different anatomical structures have their own unique feel. So feel on your own arm, your elbow for instance. You can feel where there's a bone. You can definitely feel a bone is harder, you can't really budge it or move it. A muscle, feel your bicep. It feels different, right? And now in your elbow fold, and there if you feel closely, you'll feel some tendons as well. So your fingers will develop the different feel for various anatomical structures. Working within the end field of tissue maintains mobility. So the end field, what is that? Let's say an end field of the joint. Move your elbow straight with your other hand on your wrist. Can you feel when you straighten your elbow that there's like a bony block? You can't really move the elbow beyond that. But when you bend your elbow, when you flex it, the end feel is different compared to the straightening out of your elbow. So that is how it feels at the very end of ranges, meaning movement of joint, range of motion. But working at this end feel can also help stretch the tissues. But stretching beyond the end feel will cause discomfort and possible damage. The neuromusculoskeletal disorders. So now we move into different disorders, looking at different the neuromusculoskeletal areas in the body. The best approach to treatment of such a condition is finding the cause and not just merely treating the symptoms. This takes a lot of in-depth assessment and experience as you gain more and will gain more in the future. So there will be some soft tissue changes, some primary and others secondary. So you will have to, while you are relieving the symptoms, find out but what was the primary cause of this neuromusculoskeletal disorder. But take care, because touch and massage can contribute to the management of patients with chronic pain, but it should not lead to a passivity in your chronic pain patients, meaning that they should take responsibility for their condition. You can tell them and advise them what exercises to do and what they can do for their chronic pain. But it should not just merely be you come to physiotherapy for a massage and that is it. They need to take responsibility. And this should be a dynamic self-rehabilitation as well. Massage should be used in muscle trauma to promote healing, reduce pain, improve nutrition, reduce swelling, and the inflammatory byproducts, and remodeling of the tissue and scarring that can occur. The cycle of muscle spasm can be interrupted by a therapeutic cycle initiated with your massage. We've looked and discussed scar massage, and it can also reduce swelling and promote remodeling, mobilize and stretch the scar. But it needs to be done at the correct time and not when there is a danger of opening up the scar. In acute back pain, massage can definitely reduce pain spasm, promotes relaxation as well. So very useful to start your back treatment with your massage strokes before you move on to the different tools and other soft tissue techniques. In chronic back pain, massage can definitely reduce the spasm. Edema can be caused by various conditions. It can be as a result of inflammation, where you've just sprained your ankle. Can be because of pressure on parts of the circulatory system. Heart malfunctioning, heart conditions can lead to edema in the limbs. Also, where the lymphatic system is insufficient, meaning something is wrong in the actual lymphatic system, where there's venous problems or other medical conditions can also result in edema. This excess tissue fluid can reduce the nutrients to the cells, and that is a problem. Edema, because of the protein-rich content, can cause adhesions, which restricts range of motion in joints as well. So it is very important to reduce the edema and manage it appropriately. Massage should not be used when edema is as a result of organic disease, acute injury, or thrombosis. This is where massage is contraindicated. Swedish massage should be used for hydrostatic edema. So there's a selection of techniques that you can apply around the edges of the ulcer or wound, but definitely not on it. Or manual lymphatic drainage for lymphedema. So very specific massage techniques for these conditions. The effects of massage in edema are considerably enhanced if the patient wears pressure garments or bandaging after your session. So between sessions, pressure garments or crepe bandaging applied from distal to proximal, very useful to help maintain the effects that you had with your massage. This can be individually tailored, where measurements can be taken and a pressure sleeve or stocking can be made for patients who have lymphedema. Complex physical therapy is the treatment of choice, and these can include manual lymphatic drainage, pressure garments, and exercise. And here the pressure garments, you can purchase them, but the occupational therapists often make individual pressure garments. Massage can also be very useful in sports, with warming up the area, facilitate flexibility. Massage also very helpful, assisting in recovery from fatigue. It promotes healing, remodeling of soft tissue. DOMS, delayed onset of muscle soreness, blood lactate levels, perceived muscle stiffness can be reduced by massage. Post-event massage, this is where you often see, say for instance, professional cyclists, they have their massage about 2 hours or so after the event to just help them recover faster for the next day's cycle stage. The multidirectional stretching effect of massage may be more effective than stretching exercises alone, and research has also said that stretching, as it has always been a controversial topic, may not be the ideal, but read up on this and find the best scientific evidence. Massage should, however, not be applied immediately following a tissue injury. So we all know that massage can be very relaxing, can have sedative effects for somebody who has a lot of stress, let's say work stress. There's anxiety and depression. group therapy. There's other uses of relaxation massage as well, but it can definitely have and be a form of a sedative massage. So looking at client groups, it can be used for various groups. Like people with long-term terminal illness can definitely find a lot of use from massage. People with neurological disorders, abdominal massage, people with cancer, edema in oncology, pain, plastic surgery, HIV and AIDS. Patients with dementia, our older population group, can be useful in occupational health, in treatment of work-related problems, mental health, people with learning disabilities, baby